Question I get asked a lot as an ICU nurse is, how do you know if someone is in pain when they can't speak to you? To which my response is always, well, there's a lot of things that we can look out for on patients and monitor to ensure that they are not super uncomfortable. And the tool that we use for that is the Cpot, also known as the Critical Care Pain Observation Tool. For this tool, you can score anywhere from a 0 all the way up to an 8, 0 being no observed pain and 8 being you're observing what looks to be a lot of pain. There are 4 main sections that we will evaluate. First are patients' facial expressions. So if they have no muscular tension observed, they would be a relaxed neutral score of 0. If the patient appears to have a little bit of that brow furrowing, that tightness around their eyes, then we can score them a 1. And if they have all of that, plus they're like really grimacing, closing their eyes, we would score them a 2. We also will rate body movements from no body moving to like thrashing and trying to pull out their tubes. We will rate muscle tension all the way from being super relaxed to just super resistant, super tight, grimacing, very like rigid. Last section is a little weird because you can evaluate patients that are vented or non-vented. For your vented patients, we're scoring ventilator compliance, meaning the patient's chilling on the vent, they're not activating alarms, they appear to be nice and calm, all the way up to the patient is not tolerating the ventilator, they're coughing, they're fighting, they're desatting, it's looking miserable for them. That would score you a 2. For non-vented patients, we'll score them in this category where they're either not talking at all or talking in like a normal tone like you and I are, or all the way up to they are crying out and sobbing, which would be a 2. We evaluate these pain scores every 2 to 4 hours in my ICU and more often if needed. And typically our pain medication orders correlate with the score that we would score a patient on a Cpot. If your patient is scoring on the Cpot, then you can go ahead and give them one of those PRN pain medications. And then, of course, reevaluate in 30 minutes, typically if it's an IV pain medication, or an hour later if it's a PO pain medication, to see what your Cpot level is to ensure that that pain medication actually changed that Cpot number for the better. I hope that clarifies what the Cpot is and how we can evaluate patients that are not able to communicate their pain very well. And let me know if you have any questions.